Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back to the show, COIQ listeners. On today's episode, I am really excited to speak with Dave Chase. He is our guest today. He is known as one of the most influential people in digital health, and he is an author, advocate, investor, entrepreneur, and he is transforming healthcare. So welcome to the show, Dave.
Thanks so much for having me on. Looking forward to the chat.
Excellent. So, before we get started, there's a lot of people out there that know who you are, but there's probably some people in our audience who don't. So let's start off maybe by you just telling a little bit about your background and what you do.
Okay, sure. Yeah, my background, I started my career in consulting with working in dozens of hospitals and basically helping them get as big a bill out and paid as fast as possible. And I'm kind of doing some of my penance now for that. and then I went and started Microsoft's healthcare partner ecosystem. So you think of Microsoft kind of makes Lego blocks, other people's assemble those into solutions. And then I detoured away from healthcare for a dozen years and was in digital media and whatnot. And then came back about a decade ago. And I sort of joke, I'm essentially a technology entrepreneur historically, and you always any entrepreneur looks for a market gap.
Yes.
I went looking for a market gap, and what I found was the greatest heist in American history. And I couldn't unsee it. And so that company, through that process, I learned a lot more. And I'm really some people call a systems entrepreneur. I think in terms of industry ecosystems and have had the fortune to do a couple of those big industry shifts. And that really put me on this mission because I'd essentially been on this scavenger hunt for the last decade on who's cracked the code on healthcare. Everybody knows it's broken.
Yeah.
But for most people, it's indecipherable as to how to make sense of it. And I found these people who'd crack the code, and this metaphor came to mind of the Rosetta Stone, because that helped decode the formerly indecipherable Egyptian hieroglyphics. And these people had cracked the code, thus the Health Rosetta, which is this blueprint that it wasn't me climbing up to the top of some mountain and, crossing my legs and dreaming this stuff up. This is stuff that had been, amazingly, most people don't know about it. And just remarkable things that happened. So it was this dichotomy between this kind of dystopian reality that we're in today, where we're bankrupting families and country and producing mediocre outcomes, while also creating record levels of burnout and even suicide amongst our clinicians. On the other hand, these people who'd crack the code was utopia by comparison. So I kind of joke, well, it's just a marketing problem, right? They knew about this system that's not utopia, it's reality. They just mainstream yet. So my mission is to really just mainstream that concept. And so we've started with the employer arena, and we can talk more about that. But that's basically our mission, is to, I think of, if a health plan was a person, you'd want it to be your mother, right? A great mother. They look out for you. They keep you healthy. They help bring you back to health. When some idea sounds like it might be a good idea, it's really not. They'll keep you out of harm's way.
Sure.
And, that's kind of the sort of metaphor I think about in terms of a great health plan.
I don't think I've ever heard that before. That's interesting. Yeah.
I think I came up with it, but who knows? You hear stuff, and you just. Although it's funny, I was talking to a guy a couple of days ago. It was an investor, and we were talking about it. And he sort of said it in so many words. I was like, "Wow, that's interesting." Somebody else would say that, so I'm sure somebody else.
Sure. Yeah. That's great. I love the work that you're doing. So everything on this show is really about us coming together, sharing stories, sharing some of the challenges and best practices to kind of move the needle in an industry that's very complex, very difficult, but to help health innovators be more successful in their commercialization of innovations. So you and I have had some conversation about this phenomenon of the zombie graveyard. So let's just jump right into it. And so, let's talk, what's your perspective of the zombie graveyard, and why do you think some health innovators succeed and why some fail?
Yeah, I mean, it's really difficult because there's a lot of people, sort of pushing you, particularly investors, and sort of the optics of landing the big health system is supposed to be the golden ring, when I think it ends up being a boat anchor for most of these organizations. Mm-hmm. And that is, really almost everything that is the essence of what a large health system is about is the polar opposite of what it takes to bring innovation to market. And so, a good rule of thumb, I think, is, don't pursue a customer that's larger than your install base. And unfortunately, most of the startups are pursuing that. And, to be maybe kind of blunt, a lot of the innovation is trying to either pave a cow path or put lipstick on a pig. And we're saying, here's the big challenge. There are actually organizations who are fully invested in the new model. And I think what a lot of people are doing is trying to sell, the equivalent of selling, new commerce tools into Sears and Kmart in the late 90s, when, of course, they would have been better off working with Amazon, right? Mm-hmm, or some other e-commerce innovator. And there are the equivalents of the Amazons and Wayfairs or whatever out there. The challenge is, and that's kind of what we try to do at some level, is kind of do this market, making or matchmaking between those. And so that's, you avoid being a zombie, number one, by picking your customers. That sounds kind of crazy because you're just trying to survive. Yeah. And I've been there, but that you picking your customers will be the life or death decision for your business, is my belief. Mm-hmm. And I believe if some, large organization is coming and knocking on, which they did because I had a fair amount of visibility, I think the burden of proof is on them of how, demonstrate how you have worked with a very small organization and put this through, had success, and reached it to the whole organization. I know some successful companies, one of which was acquired by Fitbit. They had tons of peer-reviewed studies and things they'd done with health systems that proved their approach worked. And it never went to scale on any of those health systems because at the end of the day, what they were doing was going to reduce revenue for that health system while helping patients get healthier. Mm-hmm. So that's the type of thing you have to be very disciplined on who you choose as your customers. And I think most people are just in survival mode and just trying to get, any customer. And believe me, I've made that mistake. So I'm just trying to help other people avoid that mistake.
Yeah, absolutely. So true. They're just so desperate for cash flow, or so desperate for the big story, right, of the big flagship that they can kind of hang over their brand. So tell me a little bit more about this matchmaking.
Yeah, I mean, the way we've decided to go about doing it is really just go upstream, because I looked at all the dysfunction in healthcare, of which there's many, many areas of dysfunction, always came back to the way we purchase healthcare at the core is radically broken. And until we change that, none of the downstream changes make a difference. And so where we're focused in on is the employer. That's the tip of the spear. It's half of the revenue of the industry. It's probably 3/4 of industry profits. No act of Congress is required. As soon as the employer has the mindset shift that, no, fixing healthcare isn't like solving Middle East peace, with, I think a lot of them look at it that way, they'd like that fix too, but it seems hopeless and out of their control. Yeah. They know it's actually absolutely in control. We're a 7-person company. We're doing it. I've seen, companies over 10,000, employees do it. And so what we're doing is matchmaking the employers, I should say, we've kind of been, building demand. So if you think of supply and demand through the book and media that I do, these people go, okay, enough, like we got to do something. And then we match them up with accredited benefits consultants. I believe that benefits brokers are the single most underestimated role in the entire healthcare industry, probably by extension, the US economy. For better or for worse, sadly, it's been mostly for worse, they make the decisions that that most companies defer to their decision-making. And that is what has led to 20 years of wage stagnation and decline for the working and middle class.
Yeah.
And so what's happening there, and we're seeking to accelerate, is, remember stockbrokers? They went the way of the dodo bird. The smart ones reinvented themselves as financial and wealth advisors.
Right.
That's where they had more aligned interests. And so these great benefits advisors, they're frankly underpaid. They're worth their weight in gold. They're the ones who, frankly, we modeled the program after. They're the ones who have shown over several years, even a couple decades, how to do this. And so then we do this matchmaking. And it's kind of weird that we have this industry, this trillions of dollars that are spent, and there's no objective third-party mark of quality, whether it's for a benefits consultant or whether it's for a health plan, even a healthcare provider organization. I mean, you have these bogus, like, we're the best hospitals or whatever, that's largely just a marketing charade. And so we say, okay, we're going to represent the interests of the employee, the citizen, the member, and identify these folks who, unfortunately, the way the industry was set up for benefits brokers, they're pitching themselves as buyer's agents and getting paid like seller's agents. Or put it another way, if I was to sue you and also pay for your attorney, that would be ridiculous, but that's how the healthcare industry has worked. So the folks we accredit, at a minimum, they disclose all their fees. We found up to 17 undisclosed revenue streams. Better yet, they're only paid directly by the employer or the union or whoever's the purchaser.
So how is that making a difference? Let's talk about some of those stories.
I mean, it's amazing what happens. We have really been doing this in earnest, of kind of trying to accelerate what was already happening. It's not like we came up with all this stuff. But what we see almost every day, I get another story of this city, this manufacturer, this retailer, they drop their spending 30%, 50%. How the heck did they do that? And what's the impact of that? Well, how did they do that? It's pretty simple. Unit cost. We're paying too much on a unit cost basis for things like imaging and surgeries, basically medical care. And we're paying too much on a unit cost basis for medication. If you get rid of what we call pricing failure, where there's pricing failure is when there's no correlation between what you pay and the quality you get.
Right.
So, when you get rid of that and you remind people, gosh, healthcare wonks have known for at least a decade that a third to a half of all healthcare spending is waste. PricewaterhouseCoopers Institute of Medicine, there's no surprise there. It's probably only up since they did that. And the other thing that a lot of people aren't recognizing is the value creators in healthcare, the clinicians, the nurses, the doctors, the pharmacists, they're getting less than 25 cents of every dollar. And so once you remove, frankly, price gouging, and in some cases over-treatment, then you can have that impact. And the real impact, sure, it's great for the company to have spend less money, but virtually every company says, you know what, we already committed those dollars to our employees. And so we're not going to put that to our bottom line. We're going to put that back to our employees. And we've seen everything from companies paying for college educations, much bigger dollars in the profit sharing pool, just, getting rid of having premium holidays if people have premiums for their employees. A couple great examples recently that came in. One was it was a company that owns convenience stores, and they had an hourly worker, and she had some condition that would put her on an expensive medication. And once they changed their drug procurement, the cost went down so much, the employer said, hey, we don't want to have cost sharing for that. We just want them to be well. And for that working class individual, what that meant was, for the first time since she'd had kids, she was able to take them on vacation.
Wow.
Yeah, so that's the type of thing. Or the forklift driver who's able to retire with a 7-figure retirement payout, because in their case, it was an employee stock-owned company, so that they reduced their spending from $8 million to $3.5 million while they improved the benefits for the employees. That all went to the bottom line, increased the value of that company. So the retirement payout went dramatically up for a guy who topped out at $45,000 a year. So that's the thing that really excites us is, these people who are able to have a college education or able to take a vacation or have a retirement, when most people, frankly, the way I look at it is our healthcare system has shoved people down Maslow's hierarchy to where they're in survival mode. Mm-hmm. If you don't mind, there was this moment for me that was really kind of this aha moment where I woke up March 9th, 2016, looked at the news from the Michigan primary for the presidential campaign. Bernie and Trump won. And I was like, that is not normal, right? What is going on here? And you start to hear about populism. And I Google, what exactly is populism? And when does populism rise? Populism rises when there's economic depression. Like, what exactly is economic depression? Well, one of the definitions is 2 or more years of wage stagnation and decline. By that definition, over half of the workforce is in a 20-year-long economic depression. Overwhelmingly, at least 95% created by healthcare, because employers are spending a lot more money. It's just all healthcare. And so when you think of an economic depression that is more than twice as long as the Great Depression, then you have to ask yourself, how could the Bernie Trump phenomenon not happen? Mm-hmm. And we have our healthcare system to thank for that.
Mm-hmm. So I love the stories that you're telling in the real human impact. And, we've got to get more of those stories out to just really encourage all of us as an industry that change is happening and it's possible. Because it seems like, the 800-pound gorilla in the room. And, like you had said before, we all know that it's dysfunctional and we're all moving to make change. And sometimes it can be really discouraging because you just think that, it's not happening or it's not happening fast enough. So these stories are just really great. How does this matchmaking impact or influence a health innovator? What do they need to do differently in order to be a part of this ecosystem that you've created for real change?
Yeah, I mean, this was part of, my last health tech startup. I was just frustrated, like, why, isn't there more fertile ground for startups? I mean, one of the reasons, after I left Microsoft 16 years ago, people were like, oh, you're going to do a healthcare startup. I was like, no, healthcare is where startups go to die.
Right.
I like healthcare, but I like businesses that survive. And that's where I sort of got at the root cause issue of that. And so I think for the innovators, obviously it depends on what area you're in, right? In terms of you can, there's services innovation. I think a lot of the most interesting thing happening is healthcare services innovation, from primary care, physical therapy, behavioral health. There's a number of things that are really exciting there. And then it's the things around that. Certainly where we're particularly focused. I mean, I wasn't a health benefits guy. I mean, I'd received benefits, as a CEO,
right.
I'd check, but I didn't really know about health benefits. And so there's a lot of activity around that. And so certainly, I would encourage people to look at our blueprint that is on our site and say, hey, how could I add value in that? Because I actually tweeted out this morning, maybe I was feeling a little, salty or something. I was like, 98% of health tech, venture-backed health tech companies are, one, just gaming a reimbursement system, either Medicare Advantage or the employers. They're paving cow paths, they're putting lipstick on pigs, or it's just kind of a Silicon Valley boys with toys centric, let's reach the worried well or the narcissist versus actually tackling the big problems, where the dollars are really spent. And the good news is there are endless problems to solve. You just have to get at the areas that are actually addressing. For example, you can worry about, all these fitness trackers. And believe me, my drug of choice is exercise. So I'm way into that. I was, collegiate athlete, blah, blah, blah. I believe in personal wellness, but actually the problems that we have are the 5% of the population who consumes 50 to 80% of the healthcare dollars. And a lot of those things aren't even traditional healthcare things. They are psychosocial things. Mm-hmm. And so there's opportunities around that. And so a big part of it is, deep, whatever sort of is an area of passion, area of expertise, do a deep immersion. Get out of your office, get out into the world, and you get into this. The nice thing about this ecosystem we have is it's a magnet, right? Magnets attract things and they repel things. And so there's a bunch of people who I'm sure think, well, they either just don't know who we are, which is fine, or they just think we're crazy or delusional or whatever, and that's fine, right? I'd rather we don't waste each other's time. And then other people, whether they're a doctor or a PT or an independent pharmacist or a health tech innovator, it brings these people together in those collisions and those deep dialogue. You can't not see opportunities to innovate once you get out there, and because there are a multitude of problems, I can assure you.
Yeah, absolutely. There's definitely a lot of market gaps, a lot of problems out there to be solved. So in your experience, what are some of the strategies around best practices for, creating a viable business model in healthcare? I mean, obviously everybody's business model is going to be different, but there's a lot of complexities in building out an effective or viable business model in healthcare with, the payer not being the buyer and the not being the user. And, so just in your experience, what are some of the strategies that you would recommend for our listeners who are in the trenches today, building out solutions and trying to figure out how they're going to take it to market?
Yeah, I mean, it is an extreme challenge. I always tell, many of my friends are in the tech industry and they're engineers, and I was like, guys, the make or break thing will be that combination of business model and go-to-market strategy.
Yep.
And if you don't get that right, the greatest technology in the world won't make a lick of difference because it will never see the light of day. Yeah. And so, the part of what we're trying to do is, simplify the value chain. Mm-hmm. It is complex by design. And it is remarkably straightforward once you remove this and then you rebuild this layer. And so I think a big part of it, as I mentioned, the immersion is spending time with these new models. Mm-hmm. And so, for instance, I had been writing about direct primary care as a healthcare services innovation, starting about a decade ago. And I saw it as a microcosm of where the healthcare system needed to go. It wasn't the one silver bullet or anything, but it was an important piece.
Yep.
And there was a guy, unbeknownst to me, who said, okay, that's pretty interesting. I'm going to go into these practices that are doing this and see what their problems are. And what were they doing? they were, because it's a membership model, rather traditional primary care is all about, billing and volume and referrals and all that. What were they doing? They were like using Excel. They were using gym membership software because they had this monthly membership. And then they trying to sell to employers, and some employers would cover the member or 80% of the employee and maybe a family member. And you got into it, it's like, wow, there's all this nuance there.
Yeah.
And so this is a company called Hint Health. So they said, gosh, we're just going to build that. And so they become basically the operating system for, in that case, payment and eligibility, which seems like it's really simple because it is a more simplified model, but there's still quite a few nuances. You still have to verify eligibility in these models, even though, you remove the 40% insurance bureaucracy tax. So you have that type of thing where, like, go in, see, at the end of the day, it is about the interaction between, patients and clinicians. And if you go in, study those new models in a particular area that's relevant to you, it could be in, pharmacogenetics, it could be in a technology thing. Those things then reveal the problems. And that's a big, Steve Blank is well known as sort of customer development and lean startup, stuff. And then, he's always about get out of the office, get in there, go in with your hypotheses. But a quote, I think it's from Mark Andreessen, he says, have strong opinions weakly held, and be ready to be proven wrong. And so that would be my advice, is to you really get out there and I keep harping on. There's a lot of problems. You just have to figure out what's a problem space that I can be focused in on, and you can stay quite focused, right? And I'm, exhibit A of being guilty on this. Of, oh my God.
Is that like even a character trait of an entrepreneur, a serial entrepreneur?
Yeah. It's
so many opportunities, so many problems to solve.
Yeah, exactly.
Yeah. Okay. So, you use this term lead-like ecosystem.
Yep.
So we've kind of touched on it a little bit, but just help me understand that term and what you mean by that.
Yeah, that's a great, so LEED, for those who don't know, is from the U.S. Green Building Council. So this is a model for how to build more sustainably built and operated buildings. And what LEED did over a 20-25 year period was mainstream this once fringe idea to where it's just the way, buildings are built now. Whether you care about the environment or not, it's much more bang for the buck. It's better. Yes, it is better for the environment. And I like the analogy because the built environment's sort of like healthcare. There wasn't this magic day where all the old polluting buildings got raised and all magically green built the next day.
Yeah.
It's very entrenched, very local. What happened was the old model waned over time. The new rose over time. Happened geography by geography. Places like Portland, Boulder, Austin were early adopters of this, proved it out. And what LEED did was they accredited professionals like architects. How do you do this? There's this blueprint. And sometimes I joke that what they didn't do was say, put recycle bins in, polluting buildings and we'll call them green, right?
Right.
Unfortunately, a lot of what passes for innovation in healthcare is the equivalent of putting recycle bins in polluting buildings. And so they said, okay, here's this blueprint. We're going to accredit the architects and they certify buildings. And so we started with, we're accrediting the quote unquote architects of health plans, these benefits professionals. And then over time, I could see a day where we would certify health plans. You think about today, you've got the biggest chunk of the workforce are millennials today, largest generation in history. Millennials and post-millennials will be 75% of the workforce in 5 years. They get things like fair trade and LEED. And I would foresee a day where somebody's looking at two job opportunities that are otherwise equal. One's got something like a Health Rosetta, who knows if we do it, but a Health Rosetta certified gold plan, the other doesn't. It would be a no-brainer where you'd go. You could even take that into the investment level. I would argue a company that's not doing these types of things is failing in their shareholder fiduciary duty, as well as there's the regulation around employer plans is called ERISA, passed in the Ford administration, I would also argue they're failing in their fiduciary duty there. And so it's odd that we have this $3 trillion plus market and there's no objective third-party mark of quality. And so that's where I think that lead analogy is pretty good, and, you know, not perfect, but we're trying to sort of follow that rough pathway of how do you mainstream something over a 10 to 20 year period. And we're fully cognizant of it taking that long. I would argue that if somebody looked at us and said, oh, they think they're going to fix healthcare in the next couple of years, they would rightfully say these guys are delusional. But when you have something that's a 10 to 20 year time horizon and it's grassroots bottom up, it becomes less and less delusional. And once you have all, you know, it's indisputable, people can touch and feel it with their own eyes, then that's when change happens.
But it always, right?
Yeah.
And it's just, that's how change happens.
Yeah.
Not overnight.
Yeah. I mean, the other thing that you see with these great societal problems that have been, you know, I don't say they're solved, but we're solving things like civil rights and climate and better food and energy independence, these types of things. Guess what? They always start grassroots. And then at some point, you know, and it's off the radar of the, you know, John Q. public, but then at some point there's a catalytic media event that then brings it into the public consciousness. So we're just quietly working away. And sure, I've got my books. I'm a consultant on The Resident, which is doing well, and that's getting some of these stories out there. But we'll have things to you know, raise up the visibility. There's a new book coming out from one of the most prominent physicians in the country, Marty McCary, called The Price We Pay. He talks about what we're doing and what our ecosystem is doing in the context of this broader thing. And he actually, despite what we're seeing and the problems he points out, he's quite optimistic. There's a lot of great stuff going on.
And we need more of that.
Yeah.
Maybe I'll have him on the show.
He's great. I would definitely encourage you to.
Yeah, yeah. So one of the last questions that I have for you is, you know, there just seems to be this magnet in healthcare, right? So there's, you know, people like ourselves who've been in the industry for decades, and then there's all these other industries that are trying to get their piece of the healthcare pie. So the, you know, the healthcare industry in itself is just really saturated with so many people like ourselves that are advocating for change and talking about different phenomenons. And you've done a phenomenal job at what I call rising above the noise, right? So part of that's been through some of your writing and your books and kind of having these unique ideas that you get out there and promote. But, you know, when I think about the parallels of what you've done for your own personal brand and your businesses, you know, what recommendations would you even have for the health innovators that are trying to rise above the noise, because they too are in a sea of 100,000 plus innovations that are trying to target the same audiences?
Yeah.
So what do you recommend for them?
Yeah, I mean, there's different ways to get at it, but I'd say the system change model we're following, the essence of it is you find things that are working and then figure out how ways to massively replicate that. This was a system change model that lifted tens of millions of people out of poverty in India and is remaking a key part of the food system. And so what they've done and what we're doing and what I'd encourage people to do is pick a geography, the one you're in, right? Dave Chase is not going to fix healthcare in Omaha or Poughkeepsie or wherever, right? There's going to be people in that community, and whatever role you have to play, be a catalyst in that community. You have an influence. It might be you're a business owner, or you know a business owner, or you're a member, you know, on a board of a school or a nonprofit, or there's a sphere of influence you have.
Sure.
And I mean, start small, right? And solve it for a school district, solve it for a manufacturer, bring these ideas. And, you know, who wouldn't want to, I mean, if you actually look at the health, put aside the money, if you look at the health impact of putting in these kinds of plans and how phenomenally improved the health outcomes are, if it was in a pill, it would be the biggest blockbuster drug in the century. And I look at it as we're open source on what we're doing. To me, if somebody had the cure for cancer and they kept it secret, that would be a criminal in my view.
Yeah.
And so share this with your sphere of influence. And, of course, if you have a role to play in that, that's all the better. And I'm a big believer in what I've done over the years is, don't go, sort of beat your chest about your particular product. Be the sort of voice in your sphere of influence for the category of what you're doing. And it can be the broad category. And then at a certain point, somebody's go, and what do you guys do? I mean, that was one of the things that happened to me with my last company was acquired by WebMD. And I had been speaking to been asked to speak at, kind of the Lifetime Achievement Awards for, one of probably the largest medical device company in the world, speaking with the CEO, their VP R&D, and here they were a large client of WebMD and Medscape, the combination there. And the salespeople had never, they were 3-4 levels down in the organization. They're like, how in the heck are you pulling together this meeting with all these people? I'm like, I don't know. I was interesting. I wasn't, because what happened, the way that came out of the VP R&D cold called me at some point. And I was writing about patient engagement in that case, and he wanted to talk about it. And I talked to him, and I wasn't like working my pitch into the first 60 seconds of the call.
Sure.
But at a certain point, he's like, what exactly do you guys do? You're not just a full-time writer, right? It's like, no, that doesn't actually pay the bills.
No.
And he's like, oh, we actually need that. And let me, and so that's the type of thing. Sell your category and be a thought leader, whatever sphere of influence you have, and inevitably things come your way. Particularly if you're doing it from a point of goodwill and trying to help people.
For the right reasons.
Yeah.
Absolutely. Well, Dave, thank you so much for sharing your wisdom with me and our audience today. I so appreciate it. So for those that want to follow you, stay connected, learn more about Health Rosetta or your lead-like ecosystem, how do they get a hold of you?
Yeah, they can just go to healthrosetta.org. And if they, your viewers, if they want to go whack friends, they can get a free download of my books there. And, sign up, get connected on just about every, thing. I'm at Chase Dave, whether it's on Twitter or LinkedIn or whatever. And so if they want to connect with me personally, that's the way to do it. And I'm happy to connect people with, that's one of my joys and I guess gifts is being a connector with folks. And so I'd welcome them to do that too.
Excellent. Thank you so much.
Yeah, thank you. I really appreciate the opportunity.
Bye-bye. What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.